We've also seen a dramatic increase in physician mistreatment, which includes serious behavior that is absolutely not acceptable.
Doctors Manitoba conducted a survey of physicians last month asking about abuse and mistreatment in the workplace. Well, the details of the report have now been released, uncovering some alarming evidence. Nearly 6 out of 10 physicians indicate that incidents of mistreatment are happening more often compared to 1 year ago. Out of 403 responses, 57% of physicians have experienced some sort of mistreatment over the last month. 62% of the respondents reported experiencing multiple incidents, whereas 15% experienced 6 or more.
These incidents of mistreatment include threats, verbal abuse, bullying, and even physical assault.
More than half of the respondents believe the rise in incidents are related to the pandemic in some way. Doctors Manitoba says incidents of mistreatment appear to occur more among physicians who are female and BIPOC, as well as physicians located in rural communities.
In my 40-plus years of medical practice, I have not witnessed the degree of mistreatment referred to in this survey until relatively recently.
Dr. Don KLASSEN, a family physician working in Winkler, says he is aware of several physicians wanting to quit or retire due to poor working conditions, an issue that will impact the healthcare sector moving forward.
I don't think recruitment is going to be, I think it will be more challenging than it has been in the recent past.
City News has spoken to several nurses working on the front lines over the past few weeks. Each nurse has their own perspective on what they call a dire situation taking place in hospitals, but all echo the same sentiment: the healthcare system is at a breaking point. One nurse says the need for more support, such as security guards and CCTV cameras, is essential to keeping healthcare workers safe.
It's certainly not a place I ever thought I would find myself in either.
New legislation now makes it illegal to intimidate healthcare workers or intimidate those accessing healthcare services, including the COVID-19 vaccine, an offense that carries a maximum of 10 years in prison. Dr. Katharine Smart, president of the Canadian Medical Association, says she is encouraged with the passing of Bill C-3.
This extends to in-person behavior as well as online spaces, which I think is important because we've also seen throughout this pandemic the importance of online spaces for physicians to share positive information, accurate information.
Dr. Thompson sharing a simple message.
We are on your team. We want to help you, and we want you to be healthy. So let's support one another. Let's treat each other respectfully and get through this pandemic together.
In Winnipeg, Alex, Karpa City News.